Really interesting. We'll get more into that later. I just want to ask Dr. Ashraf as well, because you are leading the Cardiac Diagnostic Center at MAAEDICARE Charitable Foundation. Can you explain a bit more what that entails and who are we catering to and the services that we have?
Hello, Assalamualaikum. Thank you, Encik Shazwan. First of all, I would like to give a special shout out to HS Mediclinic for inviting us to join the program today, and also big thanks to Puan Noliza for joining us for the FB Live talk today. So, as mentioned by Encik Shazwan, I am Dr. Ashraf, the head of Cardiac Diagnostic Center. So, what do we do in our center is basically all the cardiac related services, ranging from consultation, ECG, echocardiogram, stress test, and up to angiogram. So our aim is actually to provide charitable services to the B40 communities, but it also open our service to M40s, T20s, and also the refugees. Yeah.
Right, thank you, Dr. Ashraf. So, as you know, as mentioned by Dr. Ashraf, so what we do, because we provide everything at a very subsidized rate in that sense, so it's highly affordable, and we invite everyone to come in to have their health check. Because for us, what is important is that people have good, healthy living, and of course, those who are able to afford a bit more, then that cross subsidizes those who are not able to afford. So that's why we would like to expand these services, not only of course to those who can afford, but people, especially refugees and so on. So let's get back into that. So when we talk about refugees, who are these people? I mean, who are these refugees? What I don't know, that's in terms of our recognition in Malaysia. Do we recognize refugees, and what sort of access do they have to, for example, education and healthcare and so on?
Okay, so generally, just to give an overview, refugee is somebody who has been forced to leave their country. So this is the definition of it provided by the UN, and that is because of any form of persecution that they've experienced, such as wars, human rights violations, and such. And technically, once they have left the country, international law says that the international community are to step in to assist. Malaysia is not a signatory of the Refugee Convention, or 1951 Refugee Convention, which provides, details the assistance that we are to, member states are supposed to provide or obliged to provide, and this includes right to economic activity, to schooling for the children, healthcare and such, basically livelihood activities. So essentially, the refugees who are in Malaysia, who count up to about 180,000, and these are just the registered ones with UNHCR. There are many others who are still in the process of being registered. They, do not have access to education. Their children do not get national schooling. They are not allowed to access or work, and therefore, and they are still required to pay for everyday expenses such as food, shelter, and one of the biggest expenses is healthcare, because in Malaysia, refugees are treated like other foreigners in that they have to pay foreigner fees, which comes up to a few hundred times more than what the locals would pay. So, for example, in a third-class ward, to deliver a baby, a Malaysian would pay, I think, about 30 ringgit. It's in the tens of ringgit. And on the other hand, a foreigner would be required to pay, 2005 and beyond, and including hospital stay and so on, it goes up to 4,000 or 5,000. With the UNHCR card, they now are allowed to get 50% discount. So it is help for them. However, half of 3,000 ringgit is still 1,500 ringgit, which is 500 times more what a local would pay. So they have a lot of issues that they have to contend with being here. Yeah, and the other thing to say as well is, they're not here forever. Once they have the UNHCR card, they are in a queue to leave the. Well, there are three possible durable solutions that they are provided by UNHCR, which is either to be resettled in another country, usually a Western one, such as in the US, Australia, and such. There's also the option to return to their own countries if things are better. But also they also try to reintegrate them into the host country, which is not currently what's an option in Malaysia. So the resettlement option is the one that most of them will be looking forward to, but it takes decades sometimes, 5, 10, even 20 years before they get to leave. So in that time, if they're not allowed to work, then the children are not going to school, and they're still having to contend with very expensive healthcare and other expenses. It's a very debilitating way of living.
I'm sure.
Yeah.
I'm sure. So, and in that case, just to follow up on that, we're talking about hundreds and thousands of refugees living, currently in Malaysia. The circumstances brought them here rather than, something that they want from the get-go. But in that sense, so how are they making a living here in Malaysia? Because we know having the funds to afford healthcare, for example, it's a big issue for them. So I don't know, how do they go about making a living here in terms of getting work and so on and so forth? And is that like the biggest hurdle for them to have just proper access to just foundationally things like healthcare and education and so on?
Yeah. Essentially, it's a balancing act. It's a very difficult juggling act. Legally, they're not allowed to work. There are certain sectors that have been opened up at various times by different agencies to allow them to work in certain industries. However, most of them will be working in informal settings. Either some cater food, some sweep roads, cut vegetables at markets, collect scrap metal. But even that there's a lot of risk in doing so. For example, some of the markets were restricted to them during the MCO. If you remember, some of the Kuala Lumpur markets, they were restricted from participating. Yep. So now you'll see them still helping and evolving. And a lot of these vendors need the help, actually. Yep. So they are helping them on the outskirts of those markets. And, those having a little motorcycle to collect scrap metal, they sometimes get picked up in raids. Those going around cutting grass, they get picked up by just going to work. So you need to always have some spare cash to be able to pay to get released, or to get your vehicle that's been confiscated to be released. So it's not easy. As for education, thankfully there have been some informal learning centres that have cropped up over the years, set up by NGOs, a combination of NGOs, community leaders, as in refugee community leaders and such. And you would see that, you would see appeals for help to sustain these schools. UNHCR helps also in providing a registration to these community of schools, to providing teacher training every once in a while, and assistance in terms of funds sometimes. But largely, fundraising needs to be done to sustain it, because the parents themselves are not able to pay for the fees. And it depends. Some communities are willing to pay for education. Some do not look at that as being priority, especially those whose parents come from backgrounds where education is not something they've had. So thinking about the Rohingya, for example.
Yep. All right, thank you. And going to you, Doctor. So basically, having heard all that, having problem and access to funding and finding the right kind of medical treatment, and of course they do not get the subsidy that we get as Malaysians with government hospitals and so on. So in that sense, what do Medicare provide? Just in terms of services, and how does that help refugees if in case we have refugees coming to our centers? Of course, we also cater to definitely our own Malaysian citizens, but in particular refugees. And this partnership that we are kind of trying to ink with Refugee Emergency Fund, how does that help?
Thank you, Jason. So how Medicare can help is, first of all, Medicare, we have a patient welfare fund. It will help to screen those patients who needs the financial aid by these patients. So, for example, our partnership with Refugee Emergency Fund, what they can do is they refer one of the patients to us with the details, with the necessary information that we need. Then we can go through the application, and if the refugees deserve to get the financial aid, of course we'll give it for basically for free. And then
And what about the rate itself that we provide?
okay, the rate, what we are giving to NGOs, especially to the Refugee Emergency Fund, our rate is actually about 2 to 3 times cheaper than going to public and private hospital. So if, for example, one of the tests, let's say stress tests, if you go to our place, normal price is around 210, and then for somewhere in private hospital, about 3 times higher. So for the refugees, probably we just give them about 100 ringgit. So we reduce the price to help with the refugees to get healthcare and quality and affordable healthcare. Yeah.
All right, thanks, Doc. Yeah, I mean, as the Dr. Ashraf mentioned, it is a lot more affordable in the sense that, and even though our rates, they are tiered rates in the sense that if you do come from a certain level of certain background and so on, we might be able to open up discounts and so on and so forth. But of course, this is also supported by anyone else who wants to come and get their health checked by Medicare. And it's not just dialysis that we mentioned, also especially with regard to health screening when it comes to your cardiac health and so on and so forth. It's very important. We know, for example, in Malaysia there's a lot more number of patients who suffers from kidney failures and cardiac arrest and so on and so forth. Maybe you can go into a bit into that, like just in terms of the health situation in Malaysia, and of course this applies as well to refugees. And I'll get back to you, Pan Noliza, later on. But what's the situation right now, and what what are we facing, and how can people out there prevent this from happening even more?
So in terms of the situation in Malaysia, if I remember the white paper speech given by our previous Minister of Health, the numbers are quite scary. If I'm not mistaken, about half of Malaysians, 1 in 2 Malaysians are obese, and then 1 in 4 Malaysians they have hypertension, 1 in 5 have high cholesterol, and I think about 2 in 5 they have a risk of diabetes. So these are the numbers just for Malaysians, and we can't imagine the numbers for refugees. So moving forward, I think for us Malaysians and refugees, we need to have a early health screening so that we can actually alter, we can modify the risk from high risk to low risk. So for Malaysians, how they can help the refugees, they can come to us, do the screening, and then for the funds that we are getting, we can give it to the refugees. It's like paying forward for the refugees. Yeah.
Thanks. And getting to a point, basically you've been helping, Emergency Refugee Fund has been helping a lot of refugees get relevant healthcare coverage and so on and so forth. What are the most common cases that you're seeing in terms of refugees going to you, requesting help and so on? And also, do you actually have the full picture of what's happening on the ground, or because you did spend, I think, around 1.4 million ringgit for over 2,000 patients, helping over 2,000 refugees and so on and so forth. So what's the situation really with the refugees, and what sort of cases that you've seen most often?
Okay. So, yeah, being a refugee emergency healthcare support system, it is largely the emergency care that would come to us. Sometimes, what do you call it? Referred to us by the community leaders, or sometimes the healthcare professionals themselves at the hospitals, and these are mostly, they're at the emergency room, having had an accident, broken bones and such, and needing to be help with the deposit, or somebody who's had a surgery and needing to be discharged. So those things, they make up the bulk, the numbers. But in terms of the proportion of how much is being paid, that would be a smaller amount, because we also have amongst our refugee clients coming to us the cancer patients, and we don't dare to take too many because it is far more expensive, and we usually, when we do, it is one that is a more long-term assistance. We talk to the doctors. So recently, for example, we've been taking on pediatric oncology patients, so children needing cancer treatment, because we've developed a relationship with a particular hospital in Malaysia that is providing that. Not all hospitals do, and the oncology team there have kindly offered support for them. So we've had about 5 to 6 children who've had various various forms of cancer, for example, Wilms tumor, neuroblastoma, leukemia and such. So for each of them, the requirement, we will discuss with the doctors to ask what the prognosis is, so knowing that by doing that treatment, the child will be able to have recover and have a future. We then take it on. So fundraising is therefore done, and this goes up to 100,000 sometimes, 100 over 1,000 sometimes, and we've had some children go through this over 2-3 years, and they're in remission and they're doing well. So essentially, cancer would be one that will take up a large chunk of what is spent on. Other cases would be heart cases. So we've had some angiograms and such. Inguinal hernia is something that comes quite often. It's, kidney stones and such. So we don't always just go to government hospitals, because sometimes the wait is extremely long. So we have over time developed relationships with some private doctors who are willing to give waive their fees, but we then just pay the hospital fees. So it's essentially assisting our mission is not just to give funding just like that. We also try to assist to find the best possible solution for them that is cost effective, and work with healthcare professionals who are willing to help too. So, for example, providing a day surgery rather than one that needs overnight admission, because it's far cheaper. So, advising them to come by 9, have that day surgery, and just, for example, hernia, that being one. Well, you talked about dialysis, CKD patients, chronic kidney disease. That is one kind of that is one that is not so easy to take on, because it's a lifelong disease with a very poor prognosis most of the time. But it is one that the refugee community is not spared. For them, we are trying to see whether we could help with 1 or 2, working with UNHCR as well, in that they will try to see whether resettlement can be quickened for these patients. So perhaps we could try to help while they are here, and they can then go to places where treatment and also perhaps even transplants could be more easily available. But in terms of the general data, we don't have. Yeah, it's not so easy. It's so easy to have because a lot of them hide their diseases. They know that it's not going to be easy for them to pay for. They have to prioritize their children, their families, food and shelter. So often they stay home and suffer. And even UNHCR only knows whoever is reported to them.
Yeah, I mean that's the sad situation for a lot of these refugees as well. First of all, they're not necessarily they don't necessarily feel welcome in this part of the world, but at the same time, they have to live with whatever situation that it befalls on them. So whether they have poor health or whether they have good health and so on and so forth, they live like us, like many of us, but with so much limitations and barriers of just living a quality life. So in that sense, how do you find people, for example, you're dealing with refugees and also you're dealing with sponsors and general public and so on. What do you think is the current, I think, just in terms of perception of the public when it comes to these refugees, and how have people been just in terms of supporting you and supporting the organization in helping all these refugees?
Yeah, mashallah, I think in the social media, for example, we see a lot of backlash sometimes whenever there are stories about refugees. But I think it also reflects the group of people who are actually using social media. It just reflects the groups of people that use social media, perhaps because quietly there are incredible Samaritans out there assisting. So the only reason Refugee Emergency Fund is able to do what we do is because of the support that comes from the general public. So our funds are all gotten through fundraising, crowdfunding on social media such as mainly Facebook, Instagram, and also WhatsApp. And it's whatever we collect is whatever we give, and it's usually the specific fundraisings that we do for a particular case. Especially those cancer ones, needing 100,000 and such. People are have been very generous, but very quiet in doing so. So I think that the general Malaysian public, there are segments who may be swayed by the rhetoric that they are here to make our lives difficult, or the refugees are here to cause trouble. But essentially, they're actually victims. They are victims of circumstances, as you say, and there is another portion of the public that quietly supports them. So we are very thankful for that. However, it's not so sustainable. It comes and goes. There are waves. So during the MCO, we were, thankfully, help came very, very easily. But there is the donor fatigue, as everybody knows. So currently, it's a little bit quiet, and people are also tired. So yeah, we will try other ways as well. Probably trying to ask from the corporate bodies and such. But I wouldn't say that the Malaysian public is all against. There's a lot of support still as well.
Yeah, I'm sure there is, because as you mentioned, you've been able to help over 2,000 refugees, and mostly comes from donors, and raising over 1.4 million ringgit to help these refugees as well. So that is a lot of money. There's a lot of funding, and there's a lot of help out there. I'm sure a lot more people want to help, just do not know where to reach out to and so on. And we'll get back to that in a bit. So you can do a bit of plug as well through the channel. But I also want to ask Dr. Ashraf, you've been in the line, in the medical line for close to 10 years and so on. So from your experience working with B40 communities, what's the situation is like for them? Have you ever handled cases with from people who are desperate for for the service that you provide, whether your experience with HKL previously or with Medicare currently, and what's the way forward for Medicare especially, and this is something that I also can explain on my, but from your medical perspective, because there is a plan to open up free clinics, for example, for Medicare, and our cardiac diagnostics again is very affordable and so on. So, and we are trying to get more partnerships, not only with Emergency Fund, for example. We also have a clinic that we're working with, and so on. So from your experience working with poverty communities, and also what's the way forward for us at Medicare?
All right. Just to correct you, 5 years. 5 years in government service.
More than half.
Yeah, more than half. But okay. Anyway, 5 years in government service. I've seen a lot of patients who don't even have money to go back after their discharge. But the sad thing about this is we know that 70 of Malaysians, they don't have insurance. So for example, when I was in JB, there was I was in the orthopedic department, so there was a lot of fractures. A lot of people got into an accident and they have fractures. So, and they require platings and require implants. The problem is in government hospital, they don't have implants and platings on standby at all times. So we have, unfortunately, we have to ask patients to buy from one of our vendors, and then one plating, one implant costs quite a bomb, about 4 to 5,000, yeah, and then it can cost more. So sometimes these patients they have difficulty in getting in money. They always tell us like, doctor, can you just give us some time to collect the money? So in the end, it takes a toll on them. I mean, for fractures, we need to treat it immediately before the bone remodeling and all that. So at one point, we just have to opt with a cast. And also at Medicare, we do get referrals from some of our partners. The good thing is that our partners are paying for them. So, like I said, we have our patient welfare fund, which can help the patients to receive the needed healthcare services. Yeah.
And we would talk about government hospitals. What about the waiting time at government hospital? Can you give us a bit of example and why Medicare, I think in that sense, is more than ready to take on some of these cases? And can you talk about the clinic, the free clinic a bit?
So of course the waiting time in government hospitals is quite long because yes, it's highly subsidized. Of course, everyone will come to the government hospital. I'm not blaming the system for that, but because government hospital is providing highly subsidized rates, of course, people will go to the government hospital to get treatment. My experience, if you go into emergency in HKL, you have to wait about 4 to 6 hours to be treated. When I was back in my department in HKL, the operation for kidney stone will take up to 1 to 2 years waiting list. And unfortunately, when we see the patients after a few months, then we can see the decline in the renal function, and basically they are going into kidney failure. That's the sad part about that. But there's nothing much we can do. Our hands are tied because we are following the procedures and the waiting time from the hospital. So at Medicare, we also have, besides cardiac and dialysis, we are opening up free clinic. So one will be in Jalan Ipoh, is our HQ, and one will be in Ipoh. So the free clinic, basically we are giving free treatment for everything, from consultation, from medication, any procedures that the patient requires. Yeah, everything is free. So I think this is good news for the B40s and refugees, because we want to help them as much as possible. Because knowing these B40s and refugees, they don't have access to education. They don't have access to even having food on their table. So most of them are malnourished. So we want to help them, probably give them some education, some education about, good diet, a bit of education about how to take care of oneself. Yeah, so everything is free. Yep.
All right. Thank you, Doc. Going back to you, Dr. Wanuliza. So we talk about how public health access even for our own community can take there's the waiting time can be long and can be very difficult for our for Malaysian citizens themselves in terms of getting funds and so on. The situation is a lot more dire for refugees, unfortunately. And in that sense, how do you think people out? What can people out there do to help? Where can they go out to reach out to emergency refugee funds, and what else can they do in order to lend a hand and help all these refugees?
Okay. There are several ways that can be done. I mean, one of the things that Refugee Emergency Fund wishes to do, and you've mentioned training or knowledge sharing about nutrition, about what we have done for a couple of times are family planning workshops, particularly for the refugees, because we find that by being more aware of the costs required, in having a baby, particularly in this instance, they would be able to plan better. They'd be able to minimize the risks that and the amount that they will have to pay. In the long run. So, for example, just knowing that they need to go for antenatal care, knowing that it's going to be 2,500 and above when they go to deliver in just even the basic government hospital, third class ward. Knowing that the nutrition matters for the mother. In preparation of having the babies, that all is very important, because we just to share another big case, the number of cases that have come to us recently would be premature births, and that's very expensive, and it's quite often coming from refugee communities where they have early marriages. So late teens, mothers being in their late teens, getting pregnant soon after getting married. So their nutrition level is not sufficient. They may not have known about folic acid, we've even had preeclampsia cases, which I understand is highly risky when you are young and you just you're quickly getting pregnant after getting married. So having that kind of discussion with them, teaching them about nutrition and such, that helps. So what I'm trying to say is, besides Refugee Emergency Fund doing it, the general public, corporate bodies, especially those that are in that line, could help in that sense by providing such workshops or collaborating with us to do so, because every time we do it, we also have to raise funds and such. Of course, Refugee Emergency Fund is always in need of help in terms of the funds itself. Secondary healthcare particularly is not something that is easily that has assistance from outside. So Alhamdulillah, primary healthcare. So some foundations, international ones even, have come forward to donate quite a lot of money for healthcare, but it usually goes towards setting up clinics, mobile clinics, for health checkups, for primary healthcare basically. But once a child is diagnosed with a disease situation where they need to be admitted to hospital, that's when the price of treatments escalate, and that's where there isn't very much funding. So assistance towards that would be greatly appreciated, and that's where Refugee Emergency Fund helps. So if you're talking about plugging, we're actually just on a Facebook page. It's called Refugee Emergency Fund. have a look. We're also on Instagram. We have our details on there if you'd like to help, and you can also get in touch with us to see how we could collaborate to do other things besides just in terms of fun. So as I said, nutrition workshops, any other sort of what do you call it, knowledge sharing with the refugee community will also be very much appreciated too. When I talk about knowledge sharing in that sense, I mean just even the understanding of different what do you call it, medical conditions that they have that require a medical treatment, because as I said, a lot of them also hide and stay away, and it becomes worse, like you say, kidney stones and such. Yeah.
Yes, that's. I mean, again, if you want to reach out to Emergency Refugee Fund, you can check out their Facebook and Instagram. I'm sure Dr. Liza, Puan Liza, you yourself attend to all of these requests for queries or reaching out to help and so on and so forth. Similarly, with MAAEDICARE as well, we welcome any sort of collaboration. We also live on funding from the donation from public and corporate and so on and so forth. And although we do charge certain rates, we do it in order to cross-subsidize those who are not able to afford this sort of life-saving treatments and healthcare services and so on. So I'm going to end it a bit later, but just to go back to Dr. Ashraf a bit, can you explain a bit what we're doing here at HS Clinic collaboration, and how can others, whether it's healthcare professionals or institution organizations, even communities, can reach out to us to do the same?
Okay, so our partnership with HS Clinic is basically they refer any patients to us to do their cardiac screening packages in Medicare. So all the funds that we get from the referral from HS Clinic, we are putting in our fund and to help those for B40s and refugees.
This program.
This program today, we are doing a free health screening for everyone, especially the staff of. We are actually at Four Seasons Hotel, so we are doing free health screening for the staff. So we have just a simple vital signs, BMI, height and weight, ECG screening, blood donation, eye checkup, and also free consultation. Yep.
All right. Thank you. And again, we welcome anyone who wants to partner with us. We are more than happy to provide health awareness talks, to provide free health screening. We've been doing it for, past couple of weeks with a few partners, and anyone who wants to do the same for whether it's their staff or their community and so on, reach out to us. And I'm sure we'd be able to find an arrangement in terms of what you need and how we can best help that. So, last question for Puan. So we're ending this day, and the topic in itself, whether refugees deserve access to healthcare and so on. So, any final words and final say with regard to this, and anything else that you want to send out in terms of a message to the general public?
Well, okay. I'd just like to say that the refugees, just like us, are human, and healthcare is one of those things that should really be made available to absolutely everybody. It is, it's quite unfortunate that there is healthcare is easily available to some and not to others. Final words, I would like to just encourage just personally, on a personal level, people to get to know about the refugee plight, to understand who they are, where they come from, and the situation that they're in here, to understand why it is a pertinent issue. It's okay, it's a balancing act already, without working but still having to pay for rent, for food, for shelter, and occasionally going to deliver a baby. But when you have suddenly a healthcare scare, a disease that you are, it's another burden that you have to deal with, and without being able to sustain yourself with those other things to begin with, this becomes very, very debilitating, as mentioned earlier. So please get to know the situation. You know, make friends with them, help them when they need your help. And at the end of the day, you know, we're actually richer having the rest of the world at our doorstep too. Get to know them, learn, you know, enjoy their food and their culture. You don't actually need to travel very far to get to know the rest of the world. Yeah, but healthcare should be available to everyone.
All right. Thank you so much, Dr. Noliza. Thank you, Dr. Ashraf. As mentioned by both panelists here, I think it's very important that we do provide healthcare to just about everyone. In the end, we are all neighbors. We are all a single community. You know, if someone gets sick, we can easily transmit that sickness to others. So better to have everyone healthy and in good condition. You know, we are in a situation where we need to help each other. COVID has shown us that. COVID has shown us how much we rely on one another, whether it's, you know, the white flag campaign or whether it's with regard to the health issues and so on, how vaccines have helped everyone. So everyone deserves good healthcare and access to all this coverage. And in the end, it is our own responsibility. Of course, health is our own responsibility, but if we can help other people, that's something that I think we should and definitely lend our hand. Again, thank you very much, Dr. Puan Noliza. I'm surrounded by doctors, so I'm always referring everyone as doctors. And thanks again, Dr. Ashraf, for this, I think, healthy session. Just to talk about healthcare coverage for refugees, but also B40 communities and, you know, the services that we have here at MAAEDICARE, as well as emergency refugees funds, efforts to help those who are in need. Thank you very much to those who, you know, view, and hope you can share this. If you viewed it and you find it useful, share it with your friends, share it with everyone, and hopefully we can get a lot more support for the things that we do here at MAAEDICARE and also Emergency Refugee Fund. Thank you and have a good day.